you're getting a patient from the cath lab with an intra-aortic balloon pump. During diastole, when the balloon is inflating, it's pushing oxygenated blood back to the coronary arteries. And when it starts to deflate during the beginning of systole, it's going to create a vacuum in the aorta, which makes it much easier for the heart to pump against because of the decreased afterload. So while your co-workers are busy getting the patient settled, let's go over what you need to look at on the balloon pump as the primary nurse with the cath lab personnel there in case you have any questions, because once they leave, you're going to own this patient. First, make sure you plug the machine into a red outlet, just like we do all of our important medical equipment. The pressure bag is going to come attached to the machine, but that's not a good height for a pressure bag. So we want to make sure to put it up on an IV pole, just like you would an IV or an A-line. Now, come over and look at the groin site of your patient where if this was a real balloon, it would be going into his groin, into his aorta. You want to check the dressing. You want to make sure there's no puffiness. Make sure the leg is warm with a good color and that you have palpable pulses. If your pulses aren't marked, it's a really good idea to mark them because you're going to be checking them frequently and you don't want to forget where you found them the first time. So, just like a radial A-line, you're going to want to start by zeroing your balloon pump. And to do this, you must put the machine in standby. After you put it in standby, you are going to come over, turn the stopcock off towards the patient, and uncap it, and hold down the zero pressure button for 2 seconds. And you have it zeroed. Come back, recap, turn your stopcock upwards, and at the same time, another thing you're going to do every hour while it's in standby is you're going to flush the A-line for 20 seconds. Make sure everything is tightened on it. This helps prevent your A-line from getting dampened and not working as well. So we're going to go back over here after we have flushed it, which you should do every hour for 20 seconds. And you want to hit start. Okay, the other important things to look at while cath lab is still there, you want to make sure your balloon pump is an automatic, because when it's an automatic, all of your safety mechanisms are going to happen for you. It's going to inflate and deflate time itself. You don't have to do anything. It's the best way to have a balloon pump. Occasionally, we have gotten them in the semi-automatic mode, but that's a lot trickier, and that's really when cath lab has been playing with it to do something special. So if it's in semi-automatic, you want to know why. The other important thing to look at is the frequency. This is in 1-to-1, which most of the balloon pumps are going to be when we get them, because then they go to 1-to-2 or 1-to-3 when they're weaning the balloon pump. If it's not 1-to-1, make sure you have an order to cover yourself. Augmentation should be full up to the maximum, as this one is, because again, that's used to wean the balloon pump off the patient. If it's less than maximum, ask the cath lab, is that what we meant to do? Then we want to look at what our augmentation numbers are. This one is, so you see the mean is 77. Well, when the balloon is inflated, it's augmenting it up to 112. So we want to look and see what our augmentation alarm is at, which is right down here, and we're going to have that about 10 points below what our, so we could do it like 102, because that's running about 112. While we're here, let's make sure we have enough helium to get through the shift. The helium lasts forever in these things, but if it was really low on this, I would ask them to make sure I'm going to have enough to get through my shift. And they will come and change that for you, but it's pretty rare that that needs to get done. Now, one thing to look at also while we're here is to make sure that we have nice, crisp waveform on our balloon pump, and this is a really good looking waveform. We've already flushed it. It should be nice and sharp like that. You never want a dampened form because it's not going to perform as well. This is the actual waveform of the balloon, and it kind of looks like a chair. Again, those are the ideal appearances for that. So we have sharp V's. We're inflating at the dichrotic notch. And we should also look to make sure there's that we have afterload reduction. And to do that, we're going to put it in a 1 to 2. When we do it in a 1 to 2, you're going to get both assisted numbers and unassisted numbers. So right now our assisted numbers are 95 over 40. Our unassisted numbers is 100 over 51. That means we're having good afterload reduction because our systolic has come down in our assisted numbers. 95 is less than 100. That shows we have afterload reduction, which is showing that our balloon pump is doing its job well. The other thing, every hour, we want to put it in a 1 to 2, such as this, and get a strip. We're going to print a strip so that we get all of these numbers, the assisted numbers and the unassisted numbers, to do our hourly documentation. To do that, you just come down here to the print strip button, and we're going to get a strip off the back of the balloon pump. And then that way we have everything we need to document as far as our numbers go. We have our assisted blood pressure and our unassisted blood pressure. The other things that you're going to want to document every hour is your urine output, because if the balloon pump should migrate down in the patient, you're going to block off your renals and you'll get low urine output. And if it migrates upwards into the chest, you're going to clot off your left subclavian artery and circulation to your left hand. So it's a really good idea to keep your pulse ox on your left hand. You have a good waveform all day. If it starts to dampen off, you want to worry about where your balloon pump is. And the only way to really tell that is to get a chest x-ray. So whenever in doubt, get a chest x-ray. Every morning, you're going to need to get a chest x-ray and at least a CBC with a platelet count to make sure you don't have any blood loss because of the balloon pump. We're going to put this back in 1 to 1. If your patient starts to get tachycardic, you're going to see that your waveforms are not as good and your numbers are not as going to be as good. So let me see if I can demonstrate that for you. The balloon pump does not like tachycardia. As you can see, all of our numbers are starting to come down. Our augmentation is starting to come down. And the balloon pump is not doing as good a job as it was when we had a normal heart rate. So look for the cause of the heart rate going up. Look at the patient. Is he in pain? Does he have a fever? Does he need volume? Is he anxious? When we fix the heart rate, we're going to see that all of our numbers are going to improve. Augmentation is going to go up. And the balloon pump is going to be able to do a whole lot more work for us. One last thing I forgot to tell you to check on your hourly checks is to make sure that your balloon pump tubing is nice and clean. There should be no blood in it and no rust particles. If that would happen, you'd have to notify the physician immediately, because that means there's a leak and the balloon pump's going to have to come out.